This morning's Where New Mexico Stands series, it's been months since we've heard about the swine flu and panic that ensued. While fears have calmed down, the treatment isn't over just yet. So where does New Mexico stand when it comes to the H1N1 virus? And joining us this morning is Dr. Naomi Kiston, with Regional Health Officer for the state. Good morning. Thanks so much.
Good morning.
First off, the basic numbers. Where do we stand?
Well, right now there are fewer people going to hospitals with symptoms of H1N1, so the numbers of people with flu and flu-like illness are decreasing, but we're still seeing H1N1, so it's still a time when we're encouraging people to get immunized.
All right, and where do we stand on immunizations? It looks like there's plenty of the vaccine available. You see it on all the little billboards around town.
Exactly. We're really glad that finally we do have a sufficient supply of vaccine. It was hard at the beginning of the season until that happened, but now that we do, we're taking swift measures, as swift as possible, to get vaccine to protect our children. There's a great project in the Albuquerque public schools right now with APS, Department of Health, and the New Mexico Immunization Coalition to get all of our school children protected in the elementary schools as quickly as we can now that we have vaccine.
So there'll be notices going out to parents?
Exactly, and I would ask parents to please look out for those notices. If your child hasn't gotten H1N1 vaccine, it will be given in the elementary schools, so ask at your schools. Most schools are doing it. See if your school has signed up, and children under 10 will need 2 doses of vaccine.
Okay.
We're asking parents, if they take their child for the second dose between the first visit of the DOH clinic and the second one, to let the school know. We only want the kids under 10 to have 2 doses, but they need the 2 doses.
All right. We also talked during the break about how children were impacted here in New Mexico. Our numbers in terms of children dying from H1N1 higher than the national average. Tell me about that.
That's correct. We are sad that we did lose children during the season. That does happen every year. This year there were 9 pediatric deaths, and that rate was higher than many states, not every state. The explanation for that is still not entirely clear. Some things that can affect the death rates are high amounts of chronic illness, like diabetes or other chronic problems, lack of access to healthcare facilities. So someone who gets very sick close to an intensive care unit has a better chance than someone who doesn't. So a rural state may be at a disadvantage that way.
Okay.
We're looking into it.
The other thing that I reported on last year, and also we've seen some national stories, and that is sometimes there's a resurgence. Like you'll have something peak, H1N1, die off a little bit, and then you'll have a second round of the illness.
Exactly. And historically, when these new viruses show up, that does look like it happens. But most people who really know flu don't make any predictions because it's not always predictable.
Okay.
But H1N1 did come back in the fall this year after it showed up in April.
Okay.
It wasn't more severe.
Okay.
It may or may not come back. The best protection against that is immunization.
Right.
If we're all immunized, the odds of having a big problem if it comes back go down.
Okay, great. Thank you so much for joining us.
Sure.
When we come back, of course, Jason will have a look at your weekend weather and also some interesting news out of American Idol. Stay with us.